protocols have been observed. I've prayed. I know the time's of the essence. I want to get into my topic this morning, which is on reflux. Thank you for those of us that are joining on Facebook in the Zoom room. Happy to have you here with us this morning, and I hope this topic will be able to be a blessing to you, and you can share it with others that you know may be suffering from this particular illness. So gastroesophageal reflux. Sometimes they call it Gerd. Sometimes they say they're having heartburn. This is what it is. So what is gastroesophageal reflux? It's a digestive disorder. It's caused when gastric acid from your stomach flows back up into your food pipe, your esophagus. So this is where it is. Esophagus. This opens up. The expectation is that the fluid stays here in your stomach, but it starts to backflow and go back up into your system. So the sphincter, the lower sphincter, which is right here, opens up. It's supposed to stay closed. It opens up. And everything goes right back up, and you start to feel that burning sensation. What are the causes of that? It happens when gastric acid, like I said, from your stomach backs up into your food pipe. A muscle at the bottom of your esophagus opens and let the food from the bottom of your esophagus into your stomach, and it closes to keep the food in the stomach. This muscle is called the lower esophageal sphincter. When your lower esophageal sphincter relaxes too often or for too long, acid backs back up into your esophagus, and this causes the heartburn. This is what a healthy stomach looks like. And this is what someone's stomach that has Gerd, what I'm speaking about right now, or you want to say heartburn, same thing. A lot of us call it that. But heartburn is really a symptom that you have reflux. The causes of this, being overweight. It's important that when you go to your doctor, you also ask your doctor, what is your body mass index supposed to be at your age and for your height? So I cannot tell you what that's supposed to be. You should go to your physician and let them discuss that with you. Overeating. Eating food such as citrus, chocolate, and fatty or spicy foods consistently, not only one time, but like consistently, can cause this. Caffeine can also cause this. Alcohol, smoking, using aspirin and over-the-counter pain and fever medications too often, especially when you take it on an empty stomach, can lead to this as well. I know a lot of kids, they like to eat, fast food, burgers and the fries. Not necessarily, it's not good for them, all that grease. What are the risk factors? The risk factors is have a part of your stomach slide up out of your belly cavity next to your esophagus, and that is what's called a hiatal hernia. Having a weak lower esophageal sphincter, you're obese, pregnancy. A lot of pregnant women get this as well. Use some medicines, again, like the aspirin and the NSAIDs and the smoking. And people that are older sometimes usually get it a lot, but we're seeing it a lot more in young people as well. What are the symptoms? Heartburn, also called acid indigestion or acid reflux. It's the most common symptoms of gastroesophageal reflux. It's a burning chest pain that starts behind your breastbone and moves up into your neck and your throat. And it can last as long as 2 hours, sometimes even longer. It often feels worse after you eat. Lying down or bending over can also cause the heartburn. Another common symptom is in Gerd is bringing swallowed food up again to the mouth. So you regurgitate it. So people that vomit a lot, we also see this a lot in people that suffer from anorexia, because they use their finger, they go down in their throat and they cause that food to come up. And so the burning sensation causes this. Now, these ugly pictures, especially for the worst, I wanted to show the worst pictures of what the acid can actually do in your mouth. This is someone's tongue, and this is your teeth, as well as the palate. So it's important that if you're also throwing up and having those kind of heartburn, that you're washing your mouth properly and cleaning your teeth and brushing your tongue. Signs and symptoms, as I just discussed. You get a chronic cough. Some people get disruptive sleep, sensation of a lump in your throat, difficulty swallowing, again, the regurgitating of food. You get a lot of bloating, belching. You may feel like you're having chest pain, nausea. How is this diagnosed? To see if you have GERD, your healthcare provider will give you a physical exam and ask about your past health. Some people with typical symptoms may be treated without more testing. So they diagnose you by doing what's called an upper GI series, called a barium swallow, or they can do a Bernstein test. Other tests are upper endoscopy, esophageal manometry, or the test that is also done. Other test is called a pH monitoring or impedance test. And this test, the impedance test, is a test that is able to see the reflux of the acid plus non-acid liquid and air that is in your system as well. How is it treated? Treatment will depend on your symptoms, your age, and your general health. So some people may be able to take some medication for it that others may not be able to take because it may be contraindicated with medications that you're taking. And so we want to make sure that you discuss with your providers what you're taking. That includes vitamins that you may be taking in the event that they want to give you a prescription for this. It also depends on how severe the condition is. So they give you medicine to reduce your stomach acids, so antacids. Some people get medicines called H2 blockers or proton pump inhibitors. So that's like your Protonics, your Pepcid. My favorite, Lisa Douglas's favorite, Dexalent, 60 milligrams once a day. That's my favorite one. I like that one. And they have others as well. Prevacid, Protonics, again, there's different ones. Taking medicines that help to empty food from your stomach. They may give you medications to help you to make sure that you're going to the bathroom and emptying out completely. You will need a prescription for some of these. Some of them are over the counter, but if you go over the counter, you'll hear your pharmacy checking to make sure that you're not on anything. You'll also see them locked because they want to make sure that you can take them. But these medicines are rarely used to treat. So we hope that, sometimes by just adjusting what you eat, that will also treat it. So what are some of the don'ts when you have gastroesophageal reflux disease or you're having heartburn? Be careful about what you eat and drink. Don't have too much of these fried and fatty foods. Peppermint, surprisingly, peppermint. You don't want to have too much of a peppermint as well. And I love peppermint. When I make tea, I put a lot of peppermint in it. Chocolate, alcohol. But again, we in the church, we drink cranberry juice. We don't drink coffee. Citrus fruit and juices, tomato products. Tomato products are very acidic. One thing I've also learned in my profession as I work, especially when you have arthritis, tomatoes, if you don't know, it's not really a great thing you want to eat a lot of because the acid in your joints don't do well together. That's another topic. Tomato products, as I stated, drinks with caffeine, such as coffee, soda, and energy drinks. The do's: eat smaller amounts. Don't overeat. If you're smoking, quit smoking. Do not drink too much alcohol for those of you that do drink, but not us at the church. We don't drink. Right, Bishop? We drink cranberry juice and grape juice. It's good for you. Wait a few hours after eating before you lie down or go to bed. So some people have the bad habit of when they eat, they immediately want to go lay down in bed, and they want to watch television, or they want to lay down on the couch. That's not good for you. You should try to really avoid doing that. If you need to lose weight, you want to work on losing weight. We just went through a fitness challenge. It's great to be able to walk every day, at least 2,000 steps a day. It's very good. Raise the head of your bed at least 6 inches. So you can use pillows. If you don't have the fancy pillows and the fancy beds that have remotes to put the head up and all that, you can be creative as you want. Put bricks, something that's going to lift your head up. But you need to have your head above your heart. What are possible complications? Esophagitis, this is an irritation of the esophagus caused by the acid in your stomach content. Narrowing of the esophagus, also called strictures, and this can make it hard for you to swallow and end up choking a lot. Breathing problems, this happens when the stomach contents from your esophagus go into your lungs. And then what's called Barrett's esophagus. This affects the lining of your esophagus, and in some cases, it can lead to esophageal cancer. And a lot of people don't realize that acid, the erosion, the burning, the consistent burning of the lining of your stomach and the lining of your esophagus as this acid keeps coming up and building up can lead sometimes to esophageal cancer. What can I do to prevent this? Some of the same diet and lifestyle changes that are used to treat GERD can also help to prevent it. And make sure you're speaking and updating your providers as much as possible. When should I call my healthcare provider? Now, discuss all those symptoms and what can happen, what you may see. Your GERD symptoms don't get better with treatment or they get worse. You have new symptoms. You start vomiting. You have involuntary weight loss. You have trouble or pain with swallowing because it can become painful from the erosion, from how much burning you've had in your throat as well. Or you have a new cough or trouble breathing with it. You have small amounts of blood or vomit or stool, blood in the stool as well. Here's some more pictures I wanted to show, again, of the healthy stomach, things you want to avoid. And have small meals. Sometimes it's good to have those small, frequent meals versus having the big meals during the day. Here are some statistics that I found. 1 in 5 US adults suffer from GERD. That's really high when you think about it. In Canada, we have 1 in 6. It's estimated that 15% of the adults there with GERD may develop what's called the Barrett's esophagus, which is the one that can lead to esophageal CA. I want to give special acknowledgments to Cleveland Clinic, Medline, WebMed, Mayo Clinic, as well as Healthline and ACOSH Life. Please, if I did not cover anything in my summary during this discussion, please join us in the Zoom room where you're free to ask me any questions and I'll be happy to answer them for you. I hope this information was informative and that it can be utilized in your daily lives. Thank you so much for your time. Thank you for listening. God bless, and I know you're going to enjoy the rest of the service.